I must sigh as I share this story with you. A man died after being left unattended at a Connecticut hospital for 7 hours. 7 whole ass hours. This man was left unattended in the ambulance bay. And now his mother is suing the hospital for negligence, and rightfully so. This is yet another sad example. It's a heartbreaking story that highlights the injustices within the healthcare system in America, or what I and others call the sick care system in America. I mean, how in the world could you leave somebody unattended for 7 hours? Total neglect.
Well, I do believe that this is totally unacceptable. I don't believe that this is uncommon at all. I'm grateful to work in a very well-staffed emergency department, and I'm so grateful for that because I could see how these kinds of things would happen a whole lot more often if it was not as well staffed as it is.
So William Miller is his name, and as I stated before, he was 23 years old. He died in May of 2021. It was suspected that he was likely suffering from fentanyl toxicity, which you have to deal with that. He was labeled as a level 2. The hospital uses a scale of 1 to 5 in that emergency room, with 5 being the least and 1 being the worst. So if he's labeled a level 2, then we know that he is in a serious situation. That labeling for him, being labeled a number 2, did not prompt the hospital, the workers there, to do anything to help save this man in that moment. And that is why his mother is suing for negligence, and rightfully so. And this story is yet another example as to why the commodification of healthcare in the United States of America is wrong. That there should not be profits made by hospitals because of somebody's sickness. Just the whole fact that the system itself failed, the system within this hospital, and then the overall healthcare system itself failed William Miller and also failed his family. We are all interconnected in this because William Miller could have been our brother. He could have been our son. He could have been, our uncle. You just name it. William Miller is us. And so we should care that he died because of negligence, and take this to the whole next level to say that we must reform a system of sick care in the United States of America that cares more about profits than they do people. And that's irrefutable, absolutely irrefutable. And it really is a shame that there are so many sacrificial lambs on the altar of this broken system.
And this is just what happens when healthcare becomes a business. I mean, for example, you have so many patients coming in who are treating the ER as their primary care office because they don't have any other way to see a doctor. Because health insurance and health insurance costs are so expensive, they can't afford to go to a primary care doctor. And then you have greedy hospital CEOs who are always trying to do more with less. So then when people do come in with emergencies, like, this man who needed further monitoring, clearly he's not being able to be seen or given the appropriate care because those resources are being tied up with so many other patients and not enough hospital staff or hospital resources to take care of them. And I hope that the family wins this lawsuit.
Now, we know that there are millions of people in this country who are either uninsured or underinsured. In 2020, there was about 31 million people who were uninsured, and that does not count the number of people who were and still are underinsured. They cannot keep up with the rising cost of healthcare. I mean, hell, who can? There are lots of companies, both small and large, who cannot keep up with the rising cost of healthcare. That should tell us that the system itself is rigged. The system itself is wrong. The system itself needs to be reformed. And let me remind you that we are the only industrialized nation in the world that does not guarantee healthcare as a right. And it makes no sense. And so when you have a healthcare system that is not working for the people, you have situations like what happened to William. So I want to bring the Reverend Dr. Martin Luther King Jr. into this conversation. What did he have to say about healthcare? He said the following: of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Amen to that, Reverend Dr. Martin Luther King Jr. It was true when you said it, and it is true today. Now, what are some of the remedies to this conundrum? Because just because that's the reality in our country today does not mean it has to be the reality tomorrow. The remedy is universal health care. It is Medicare for all. That is what the remedy is. And as some of us continue to fight for that, I want to take you back a little bit to let you know that our fight for universal health care in the United States of America is not new. They've been fighting for this. Medicare as it exists right now was supposed to be Medicare for all until a bad type of politics got in the way. And even under FDR, when President FDR, before he died, his the whole push for an economic Bill of Rights, because President FDR recognized that the Constitution and the Bill of Rights as they existed was not enough to guarantee that people could live a good life. And so he was pushing for an economic Bill of Rights. And so I want to take his words in the economic Bill of Rights: the right of every family to a decent home, the right to adequate medical care, and the opportunity to achieve and enjoy good health, the right to adequate protection from the economic fears of old age, sickness, accident, and unemployment, the right to a good education. Hello, somebody. That's it, the Economic Bill of Rights. So President FDR was fighting, pushing for this in the 1940s. Here we are, fast forward 21st century, in the 2000s, and many of us are still pushing for that today. So this stuff is not new. I want you to check out the 21st Century Economic Bill of Rights as laid out by Dr. Harvey Kaye and the one and only Alan Minsky, who is the executive director of PDA, Progressive Democrats for America. I want you to check that out. The fight continues. And as we have more William Millers and others, because he's just the personification of others who suffer, unfortunately, at the hands of a sick care system. One of the things also that should be done right now is just making sure the staffing is right. Not understaffing at these hospitals, not overworking nurses and doctors so that they can take care of the people who come through the doors of the emergency room or the hospital. We have a problem, but this problem can be solved. And it can be solved by having universal health care in the United States of America.